So the PAE procedure, or prostate artery embolization, is done in a room just like this, an angiography suite. It's a great procedure because it's an outpatient procedure. You don't need general anesthesia, just some mild IV sedation medication. There's no big scars or incisions or stitches. And you go home the same day after we're done. That usually lasts about 2 hours. We bring you into a room just like this. We get you on the table and get you all prepped and draped. And then after, we give you a little bit of local anesthesia, and we can go either through the left wrist, the radial artery, or one of the groins, the femoral arteries. And so you just feel a little bit of pressure when we put the tube in. But after that's it, it's pretty much a painless procedure from that point on. We inject some dye like we get per CAT scan, and we map out all the blood vessels in the pelvis. And then we get a roadmap. And then using that roadmap, we then steer a little tube that's about a millimeter in diameter or smaller into the arteries that feed the prostate. Usually there's one on the left, one on the right, but sometimes there can be more than one. Once we kind of get our little tube into the right spot, we inject some dye and confirm we're in the correct spot. And then when we're happy, we inject our embolic agent. Sometimes we use little microscopic little beads or like little grains of sand. Sometimes we use an agent called blue, which is actually like medical grade crazy blue. Either way, we inject our agent into the artery, and the artery basically shuts down within seconds or maybe a few minutes. Once we plug that up, then we'll kind of navigate to the other side. We can go treat both sides of the prostate just through one single access. So once we get the other side, again, we confirm we're in the correct spot. We inject our embolic agent and shut down blood flow to the prostate gland. Also, it's important to understand that there are lots of other arteries that connect with the prostatic artery. So there are arteries that feed the rectum, arteries that feed the bladder, arteries that feed the penis. And so we have to be very careful that we don't put any of our embolic agent into any of those arteries. And so sometimes we have to close down the little connectors to those arteries. We don't actually close those arteries, but we'll close off the connectors to those vessels just to make sure we funnel all of our embolic agent just to the prostate. When we're all done, we take our little tube out, be it through the wrist or through the groin, and we put a little bandage on. If it's in the wrist, we'll hold pressure with a little blood pressure cup type device. If it's in the groin, we put a little absorbable patch over the little hole in the artery. And then when you're done, you go to the recovery room and hang out for a couple hours.